I think what sets my practice apart is my passion for medicine. I got into this as my life, and this has been my life and will continue to be my life as long as I can keep doing it. Dr. David Burrows, internal medicine. I practice at Burrows Internal Medicine in Lone Tree, Colorado. So I kind of like the appeal of getting to know people over the long term, getting to know not only the patient, but their parents, their kids, getting to know all about them, their personal life. I feel privileged that people allow me into their lives and share very personal things going on with them and let me help try and keep them going on this journey as long as we can. Just trying to keep people healthy and kicking and doing the things they want. So we do screenings for cardiovascular disease, so cholesterol, blood pressure, we check for diabetes, blood testing, make sure we're getting them proper diets, exercise, trying to keep them healthy and doing as well as they can for as long as they can. So as an assistant professor of clinical medicine at the University of Colorado, I instruct students in the clinical aspects of training for medical school. So they come out and they learn kind of how to use all the tools of the trade, also start to get comfortable going and meeting patients, starting to interview them, getting comfortable learning what questions. And it's a really cool process because they learn through their classrooms over the first couple of years. They start putting all the physiology together and you can see the wheels turning and they're getting all the connections of disease processes and they can really put it together with patients and really be well prepared when they head out onto the wards in their third year of medical school. Well, I think my mom kind of set the tone for me. She was a volunteer at University Hospital for many years when my dad was the dean of the CU Dental School. She ran the volunteer program, she ran the gift shop, volunteered huge portions of her life just to help people and help the hospital and everything out. So I felt like that was kind of something ingrained in me and I just felt like I wanted to do something to try and help our community. And I think that this teaching is really helping generate some very good providers for our community because we've got a great community and I just want to help kind of carry on the tradition and give good care to people even after I'm done. My take on life, it's all about passion. So family, my practice with my patients, and snowboarding are all very important to me. And I think they all have a role and they all feed on each other and all of them are better if you can have each different one strong. So I think that getting out on the mountain is fantastic physically and it's a spiritual experience for me and it's very, very freeing and it really kind of resets my brain and my soul to get after all the other important stuff.